So just to start, this is Barry from Barry Ayer, the League's consultant for the Health Benefits Marketplace, and I want to welcome you to our presentation for CalPERS cities on how to utilize the Health Benefits Marketplace. So we're going to start off with some housekeeping. All attendees should be listening in muted and in listen-only mode. And if you have any questions, please type them into the question box. The moderator will ask the questions towards the end of the presentation. We will attempt to address all of your questions during the presentation. If not, we will contact you separately after the presentation. I'm going to turn it over to Amanda from the League of Cities. All right, well, Amanda, so on our agenda today, we're going to be talking about the timing and planning horizon for your decision to come out of CalPERS. We're going to talk about some of the restrictions that CalPERS places on public agencies from leaving and various requirements surrounding the decision to leave CalPERS. We're going to discuss some of the options that we have for cities that wish to come outside of CalPERS and how to evaluate leaving CalPERS. And then we're going to talk a little bit about how the Health Benefits Marketplace can help to support and enable a successful transition. So I'm the League's consultant, as I mentioned, Barry Ayer. All my contact details are going to be at the end of the presentation. So if you have any questions and you want to contact me afterwards, all that information will be there. So the League of California Cities Health Benefits Marketplace is a technology solution that helps to deliver health benefits, to make it more easy to administer those benefits, and for your workforce to enroll and understand what those benefits are. There are many aspects of the marketplace, and we've had a series of webinars dealing with various different components of how the marketplace functions. And those webinars are available for you to review on the Health Benefits Marketplace website. So just to give you a little bit of background, the League has been working on putting the marketplace together for about 18 months. So there was a highly competitive RFP process that my company actually ran for the League, where we evaluated quite a few different platforms and technology solutions for members to provide benefits to their retirees and active employees. Connecture is the company that provides the technology platform for the active employee solution, and that involves not only medical enrollment, but also management of vision, dental, and ancillary services. Willis Towers Watson was chosen as the vendor partner for the retiree solution, and that is for pre-65 and Medicare eligible retirees. And we have chosen Accord, which is a company which specializes in Affordable Care Act reporting and compliance, and that is a module, which is an optional module, which is integrated into the Health Benefits Marketplace. And finally, we have Wellright, which is a wellness company, which is also integrated directly into the platform that you can choose to utilize and offer to your employees. So this slide kind of encapsulates the timeline that we have, that we are forced to work with in terms of making decisions for coming out of CalPERS. The critical date is CalPERS, when CalPERS rates are published. So typically happens right around the very beginning of June, and that is the start of a 60-day window during which you have to, you're able to give notification to CalPERS that you want to leave the system. So obviously there's a lot of decisions that, and kind of analysis which has to be done in advance of that 60-day window. And so this would be for leaving CalPERS and joining the Health Benefits Marketplace for January 1st, 2018. So we are, that's what we're looking at now. The dates have clearly passed for 1/1/2017. So, you know, in terms of like what would need to be done in the meantime, you will need to evaluate the league's, the health benefits marketplace's options for both active and retiree medical solutions. And we're ready to help you evaluate those solutions, and we're really going to go through the process of how you would do that. Another thing that should be happening in parallel are discussions with labor around the concept of leaving the health benefit, leaving CalPERS. Obviously, this is a decision which needs to be kind of negotiated and placed within MOUs, depending upon the timing of when your MOUs expire, has an impact on your ability to come into to leave CalPERS and join the health benefits marketplace. So it's really important that you start discussions with labor as soon as possible, because they'll have an important component in making the decision to leave the CalPERS and join the health benefits marketplace. Another issue is making elected officials and city council aware of this process and milestones that you're reaching in terms of evaluation. The city council will have to pass a resolution in order to be able to leave the health benefits market, to leave CalPERS. So you need to be ready when those rates come out. We will need to have done the analysis so that you understand your options, to be ready to compare them, your pricing to the CalPERS published rates, and be ready to pass that resolution if you've decided that you wish to leave CalPERS. And then we will be looking at starting an implementation process during the second half of the year, so that you're ready for open enrollment and starting a new plan year in January 1st, 2018, outside of CalPERS. So, obtaining quotes and CalPERS restrictions. So CalPERS has a number of restrictions in terms of how the carriers that are part of the CalPERS system can interact with cities that currently get their benefits through CalPERS. These carriers are not allowed to provide quotes to cities that are part of the CalPERS system until they have given irrevocable notice that they intend to leave the system. So it's a little bit of a catch-22. You'd like to know what the rates are going to be from the carriers before you make a decision to leave. The notice to leave, once you've given it, you are required to leave, and you can't come back into the system for 5 years. So it's really critical that we provide you, that we have carriers that are outside of the CalPERS system, so that you can get quotes to compare to the CalPERS published rates. So that is an important component of how we kind of get around these restrictions with CalPERS in terms of how the carriers can interact with members that are part of the CalPERS system. So geography and exiting CalPERS. So CalPERS has a self-funded PPO that uses Anthem's network. There's 3 different PPOs, and there's a single plan design HMO, but there are 5 or 6 different carriers. But the PPO is a self-funded pool that CalPERS has, so it's able to provide quotes for cities of all sizes over the entire state. So the health benefits marketplace, however, is not a risk pool. So we are going to be working with individual carriers, and the health benefits marketplace is dependent upon those carriers having a network in your specific area, so your geography, and then a willingness to underwrite your group. So certain regions may not offer significant carrier options to provide a viable alternative to CalPERS. And the reason why that is because in some of the the less populous areas there are fewer networks, and the carriers don't necessarily have good pricing in those areas. So this is part of the discovery process, and why you need to kind of look at your options before you go ahead and decide to give that notice to come out of CalPERS. So comparing rates with CalPERS. So Cigna and Aetna are both carriers that are not part of CalPERS, and they have agreed to work with the health benefits marketplace to provide quotes for cities to look at to evaluate coming out of CalPERS. So there are some further important kind of characteristics and kind of restrictions that CalPERS provides, which makes it more of a challenge in terms of pricing. So as I mentioned before, CalPERS is a risk pool. They have the claims data and the experience data, but they will not provide the experience and claims data to carriers that are outside of CalPERS. So this is an important thing in terms of what carriers typically utilize that information in their underwriting decisions. So Cigna and Aetna are not going to have access to your experience data. So they're going to have to make some assumptions and do some modeling in terms of coming up with prices. And this is referred to as blind pool pricing, and that they're blind to what your experience is. So really the networks and discounts that the carriers have negotiated with those networks and providers around the state are really important in terms of them being able to determine what rate to quote you, given that they don't have your claims data. So as I mentioned, Aetna and Cigna, they've negotiated discounts with various different provider groups and some accountable care organizations, and I'll get into that a little bit later. And these rates are going to vary by location. So again, really depending upon where you are and what options we have, the health benefits marketplace has with other carriers outside of CalPERS are going to determine how many choices and how competitive we can be in terms of getting you prices to compare to the published rates from CalPERS. So to drill down a little more deeply here on Aetna, so this is Aetna's coverage map. So Aetna does provide coverage over the entire state. However, they have negotiated and have got better deals in certain areas than others. So they look at these and they refer to them as their Tier 1 and Tier 2 areas. The Tier 1 network provides a, is definitely competitive to non-Kaiser carriers in benchmarking surveys, and that could be anywhere from like up to 3 to 5% difference, and maybe a little bit less than that in terms of how much better they are relative to the standard rates from other carriers. Tier 2 network area are not quite as competitive, but still they're likely to be in the same benchmark area as the carriers that are inside of CalPERS. And then the other areas, they don't necessarily have a network advantage, so they don't have more the contracts that they've negotiated with the carriers in that area are not necessarily going to make them competitive enough that it would be worthwhile coming out. So, again, I talk about geography. Geography and who the provider networks are in a particular area and what the contracts with the insurance companies that are outside of CalPERS look like and how deep those discounts are going to have a real impact on whether or not we are able to provide you prices which are going to save you money or be on par with CalPERS. And this kind of gives you a sense of where Aetna's network is. So, as I mentioned before, there's negotiated discounts are really important. Aetna has negotiated rates with accountable care organizations. They've also built this model for blind pool pricing, which is really dependent on very accurate census information. So knowing exactly the ages of all the dependents that are on the plan, and we have files from Aetna. And if you decided to kind of move forward with looking at this option, we would be able to work with your HR department to make sure that we are able to gather the correct information to allow Aetna to provide the best possible price, given that they don't have your claims data. So it's a combination of them understanding your census and the networks and the discounts that they have negotiated, and their modeling that their actuaries have put together will help them to provide prices even though they don't have the claims data. Cigna has a slightly different approach than Aetna, and they are going to be very competitive in LA County, Orange County, and San Diego County. And their approach in these particular areas is they have formed risk-sharing joint ventures with provider organizations, so they understand exactly what they understand what the rates are going to be, because these providers are taking on a lot of the risk of managing the provision of health care under the contracts that Cigna has negotiated. So it's sort of like a capitated rate like an HMO, but it's with a very specific network provider organization. I'm sorry, a provider organization and their network. So the rates that they've negotiated, and so Cigna is managing the pharmacy risk, and the providers are managing the medical risk, and they take on the majority of the medical risk. Interesting thing about Cigna's approach is with the narrow network, like the network provided by these specific provider groups, if a public agency decided to contract with Cigna and use those narrow networks, then Cigna can provide up to a 3-year rate guarantee for that narrow network. If in these areas you wanted to pair the narrow network option, i.e. the network option provided by these particular providers with a wider network product from Cigna, you can get up to a 2-year rate guarantee. So this is kind of interesting because it's not like that you usually get rate guarantees. I mean, you certainly don't get the rate guarantees through CalPERS. So because of the way the risk is shared with these provider organizations, they feel confident that they can take this risk for a longer period of time. And I mentioned that the medical risk is primarily being taken on by the provider network, and the pharmacy risk is managed by Cigna. So, and in the remainder of the state, Cigna does provide service in the remainder of the state, and it's just that they are going to be particularly competitive in these areas where they've set up these joint ventures. So another provider that we are working with that is outside of the CalPERS organization, CalPERS network, is Western Health Advantage, and so they are in and around Sacramento. So they've got a network in these particular counties. So we're able to provide quotes for comparison purposes with Western Health Advantage in these particular areas also. Interesting observation about Kaiser. A lot of cities do use Kaiser. Kaiser is, a very large proportion of the lives within CalPERS are on Kaiser plans. And Kaiser has a policy that if a public agency is part of CalPERS and decides that they are going to come out of CalPERS, although they can't quote you directly, what they say is that they will honor the CalPERS published rates for the first year that you are outside of CalPERS. So it's kind of like a way to get around the fact that they can't give a quote. They do make risk adjustments. So within CalPERS, because it's a large pool, oftentimes they will have risk adjustments where there's either a load where they will charge a municipality a little bit more, or a credit where there will be an adjustment relative to what the rate would be otherwise, and that's for risk sharing according to the level of your population, in terms of the demographics of your population. CalPERS would Kaiser would strip those loads out, so that would be the only difference relative to the Kaiser rates. If you decided to choose a different plan design than the plan design that Kaiser is using within CalPERS, they will just make adjustments, actuarial adjustments, to the published rate in CalPERS based on whatever changes in benefits that you are going to be offering once you're outside of CalPERS. So the CalPERS rate is still the benchmark in which they make adjustments from. So another thing to note, other carriers are reluctant to work with cities if your Kaiser penetration is greater than 60%. So this is pretty standard even if you're outside of CalPERS as well. Once the Kaiser penetration gets too high, the cost of providing services to the PPO tends to go up, and they are not anxious to take on that risk. So it's another thing that comes into the mix in terms of looking at your population and how likely we're going to be how successful we will be in helping you to provide a range of, look at a range of options coming out of CalPERS. So for the small group market, this is something that we've talked about in previous webinars. The The 100 lives or fewer is the small group market in California, and small groups are community rated. There are different rating areas within the state, and the health benefits marketplace is currently the community rated carriers that we work with are Blue Shield and Kaiser. Because Blue Shield and Kaiser are both in the are both part of CalPERS, we're not able to give you quotes. The same thing applies with Kaiser, however, that I talked about in the last slide. Another alternative is to work with a joint powers authority, so a risk pool that is other than the risk pool of CalPERS. Some of you are familiar with these risk pools. JPAs can provide a lot of different services. Clearly, one of the things that they do a lot of is providing insurance services. And the health benefits marketplace technology platform has the capability of integrating with a JPA in the same way that we would integrate with any insurance company. So all of the services that the health benefits marketplace provides would still be available to a city if you came out of CalPERS and ended up getting your insurance coverage through a JPA that was integrated into the health benefits marketplace. Again, we're looking at the joint powers authorities as another alternative for carriers outside of CalPERS, and this is an interesting alternative for us because, as we looked at those graphs and charts before, you saw that some of the carriers that we're working with outside of CalPERS don't necessarily have full coverage over the entire state. Some of the carriers also have limits on providing quotes for smaller groups. So participation in a risk pool like a JPA will enhance the health benefits marketplace ability to provide cities with, again, additional coverage options in those areas. We're going to be restricted to the size of the public agency in terms of being able to provide quotes, with the added benefit of being able to access the retiree solution, which is embedded in the health benefits marketplace, which is an alternative to CalPERS, and also all the administrative benefits. So we are in the process now of discussing with a couple of different JPAs that focus on large groups and small groups about providing this interface so we can have this additional alternative to CalPERS for cities coming out. So in terms of the plan designs which are in CalPERS, so you have a relatively restricted set of plans. As I mentioned early on, there are 3 PPOs. There is a single HMO plan design that's offered by a number of carriers, and they're very rich plan designs. So when a city decided to come out of CalPERS, you have a couple of options. We are able, with the health benefits marketplace, to provide plan designs which are very similar to those plan designs that are embedded in CalPERS. So you could effectively keep status quo, and in terms of discussions with labor, this may be the easiest route in terms of coming out, that you don't make any changes in terms of plan designs. However, because of the way the marketplace is set up, once you've come out of CalPERS, you do have the ability to have a wider range of plans, things like change your deductible levels, have high deductibles with tax advantage savings accounts, also look at narrower network HMOs. So there are a number of different benefit strategies that you will be able to employ if you come out of CalPERS that you were not able to employ within CalPERS. This is one of the big benefits of working with the health benefits marketplace, the level of flexibility that you can have and local control over your benefit options. So although that maybe sounds daunting in terms of human resource departments, because if you're in CalPERS, you've had a relatively small number of options, easier to administer, coming out and offering a wider range of options with these things like, doing HMOs, HRAs and HSA tax advantage accounts. We at the marketplace have the technology platform here. It makes it so much easier to administer these types of plans there really would be no additional administrative burden on an HR department if you chose to pursue a different benefit strategy once you came out of CalPERS. So again, two choices: keeping a status quo where you really look at plan designs that are very, very similar to what you currently have within CalPERS, or the ability to change plan design. So that would be part of the discovery process. Once you've engaged with us, we could help you look at the cost of these various different options, and then if you chose to implement them, we would be working with you to build those onto the health benefits marketplace, the specific plans that you chose, so that you would be ready for open enrollment. Again, I'd note changes in benefit strategy. This would require cooperation of labor, discussion with labor about the strategy. So it's just another point here in terms of whether or not that was something that you would want to do year one when you were coming out, or maybe you would want to put that off for a future plan year. So retiree coverage. So the way CalPERS is structured, if you have active employees and retirees getting benefits through CalPERS, when you leave the CalPERS system, you are required to bring both your active employees and your retirees out. So really been discussing the active employee solution and strategies thus far. The health benefits marketplace option for retirees is to work with the Willis Towers Watson One Exchange model, and this is a group to individual market transition model. We have had a webinar specifically on this, and it's still posted on the league's the health benefits marketplace website if you want to get some additional information. But briefly, this involves the retirees purchasing individual policies directly from insurers on the open market. The retiree exchange model from Willis then manages the benefits for retirees. It really is shedding a lot of administrative burden in terms of the interaction with retirees. Willis has a huge number of trained professionals. I think they have 3,000 people, enrollment professionals that help the retirees choose their coverage, and they maintain that level of high touch through the just going forward with retirees. So there's a great deal of education and outreach during this process. And again, I mentioned these are certified benefits advisors, so highly trained people. They're located here in the United States, the call centers. So I believe Utah, there is a call center. And Willis Towers Watson will actually prepare an analysis for you of what it would look like from a cost perspective and where the savings would be for both the city and the retirees if you chose to pursue this strategy. So again, when we talked at the very beginning, to get ready for that 6/1 date, you need to know what your options are for both the active employees and the retirees. So Willis will take your data. They will look at what kind of plans you're offering currently, where your retirees live, and they do an actuarial analysis to determine likely outcomes in terms of what the retirees will enroll in, what the impact on cost will be for the city and the retirees, the total bucket of savings effectively, and how that can be allocated between the city and the retirees. Because often there's a significant amount of savings relative to group plans, and I'll touch on that in the next slide. So this will help you kind of look at how you're going to look at your funding strategy for retirees going forward. So this is kind of a snapshot of the process. Effectively, the group plan gets terminated, the group Medicare plan is terminated, and the HRA accounts are set up for each of the retirees, and the city provides funding into this HRA. And the retiree then goes onto the individual market and purchases a plan. And the Willis Towers Watson folks walk the retiree through that whole process. Now, we have a very technology-focused strategy on the active employee side that that can be your employees can they can enroll through their smartphone. They do it online. While there is the ability for the retirees to go online and do and choose their plans, retirees typically like to do this over the phone with people, and the vast majority of retirees do their entire enrollment process with an a counselor over the phone. So they're not being forced into a technology platform. So in terms of understanding the savings from that model and why there's a reduction in OPEB liability, I mean, basically what this model is doing is it is taking advantage of some large macro trends in the economy in terms of Medicare eligible folks. So the people who are, there are about 40 million people on Medicare in the country currently. About 30 million of those people are on individual market plans. The balance, about 10 million, are on group plans. So the pool of individuals is very large, 30 million-ish, and growing very rapidly now as the baby boomers age into Medicare. So what we're seeing is there are about 10,000 people a day aging into Medicare. So the size of the risk pool for the individual market is growing, but also the average age of that risk pool is coming down as well because there's so many younger people, 65-year-olds, coming into Medicare. And if you compare that to any group plan which currently exists, even if it's a large group, 1,000 retirees, you know, the risk of that group is going to be nowhere near as attractive to insurance companies as the risk pool for the individual market. And so what we see is a great deal of carrier competition. There are federal subsidies that are available within the individual market which are not available for group plans, the better risk pools, and depending upon what your funding strategy is for that HRA, if you go to a defined funding strategy, all of these things come together to have a pretty significant impact on the cost of a retiree plan. The result is this can have a dramatic impact on your OPEB liability, reducing it. And so for every dollar saved in benefit costs for a Medicare retiree, you can expect your OPEB liability to drop by about $10. That's because that dollar represents you know, all the future value that you're going to be saving, and that's what you're saving off your OPEB liability. So all of this information is encapsulated in the analysis that Willis Towers Watson will provide to you to help you understand your options about coming out of CalPERS. So this is just a snapshot of the timeline for implementation. So this is what we will be looking at on the active employee side. So, you know, basically, you know, if you could make a decision once those CalPERS rates come out in June. Typically, we have about a 3-month period of time for implementation. That can be shrunk a little bit, giving you a couple of months to have your open enrollment. Now, open enrollment time on the active employee platform, however, can be shrunk significantly because of the way the shopping experience and the self-enrollment works. Again, I direct you back to the webinar for active employees. If you didn't see that and you would like, or if you would like a demonstration of it, please reach out to us. We're very happy to do a live demo for you of how that process works. But typically we've seen, you know, open enrollment can shrink from a month down to a week. So that 3-month period starting in June, July, gives you plenty of time for open enrollment. The period of time for implementation for the Willis Towers Watson solution is a bit longer, and that's primarily driven by the level of communication that needs to be done with retirees. There are multiple levels of communication to make sure they understand their choices. There are some specific requirements from CMS about information that they have to receive, so it takes a little bit longer. So, you know, where to begin? I think the big takeaway that I would say here is if you're thinking about the possibility of doing this for January 1st, 2018, and we know that you have to be teed up to understand your options for June 1st, that we would like to engage with you as soon as possible to help you understand your options in terms of the active employee pricing from the carriers that we're looking at. For you to get that analysis from Willis Towers Watson, and then also to give you enough time to start your conversations with labor groups if you have not done that. Vetting this with labor is really important, and if you're really thinking that this is a strategy that you would like to employ for 1/1/18, I would encourage you to, again, reach out to us, but reach out to labor as well and understand whether or not this is something that they're willing to embrace, or if it's a part of a negotiation. And then bring city council and electeds in as you kind of go through this discovery process, so that they understand the process, how we work, and what the implications are for the city. So that's the presentation. We have some time now to take questions. I also want to point out to you that that's the website of the Health Benefits Marketplace. There's a wealth of information there if you haven't visited already about the various different programs that the League has put in place on the Health Benefits Marketplace. But with that, I'm happy to take a few questions if there are any. So I'm not sure if Amanda, you seem like we had a problem at the beginning. Do you have? Can you? Are you there now?
Hi, Barry. I'm here.
Okay.
So far, we don't have too many questions coming in, but there are questions about whether the presentation will be available after the webinar. We will provide copies of the slides to everyone that's attended and a recording. And if you would like to view any of the previous webinars that we've done on the Health Benefits Marketplace, as Barry has mentioned, you can find that at www.cacities.org/HBM, and there's a webinars tab where we have the recordings. It looks like we may have a couple questions. Let me see here.
Well, as you're looking for those, I just want to make a general observation here. As you can see, because of the restrictions that CalPERS puts in place in terms of the carriers that can give quotes, we work with most of the carriers that are the big carriers that are inside of CalPERS. They're integrated onto the Health Benefits Marketplace already. I'm talking about Kaiser, Blue Shield, Anthem. Those carriers have coverage over the entire state. But because of these restrictions in terms of the way CalPERS prevents them from giving quotes, we are, in a position of having to come up with these alternate strategies. And obviously, it's a big state. Insurance companies have got networks and discounts that have different levels of discounts in different areas. So we're really working to come up with a range of options that will give, to be able to work with cities around the entire state. This is why we're really interested in the JPA option, because it has a greater level of flexibility. And the other point that I would make is, this is an evolving model here in terms of being able to address this particular issue. So we may end up working with some other insurance companies that have better networks in other areas. So this is going to be developing over time. But the restrictions that CalPERS puts in place make it so that we have to be creative in order to be able to provide you viable prices to compare to those CalPERS published rates.
Thank you, Barry. I do have a couple questions here. The first one is, how are out-of-area or out-of-state retirees treated?
Okay, so this is a great part of the being able to access the individual market plans. So these are Medicare plans, and there are plans which are available in all 50 states. So there are very, very competitive individual market plans which will allow retirees to access the Medicare network around the country. And a very, very high percentage of doctors and hospitals take Medicare. So this is actually, so compared to the PPOs that are inside of CalPERS for Medicare options, this is likely to be a very, very competitive option and kind of give greater degree of flexibility for retirees. There are many, many more different types of plan designs that are available on the individual market for retirees that are through the Willis Towers Watson One Exchange platform that are available through CalPERS. So there are more Medicare Advantage options, which tend to have very, very low costs but higher out-of-pockets. Various different structures of the standard, Medicare. Their Plan F is a very rich plan, different plans like that. And then another thing to point out, again, because it's an individual market product, If there's a married couple that are getting benefits and they have different medical conditions, they can choose different plans which really meet their individual needs. And again, this is true for out of state as well. So if one of the spouses is on, a number of medications, there's some particular ailment that they have, they may need to choose a richer plan, and the other spouse may not have these same issues. So they may be able to choose a lower cost plan, and that can drive additional savings for the retirees. And well, depending on the funding level is already set. The savings really accrue to the retirees in that instance. So, there's, again, great deal of flexibility for retirees and a lot of options out of state.
Thanks, Barry. Along the lines of the retiree side, what if you're not age eligible for Medicare options?
So if you are a retiree, I guess the question is if you're a pre-65 retiree, I guess typically what's happening now is those pre-65 retirees are remaining on group plans. So they are, implicit subsidy situation. So a city could choose to stick with that that structure. They could have those pre-65 retirees on the group plans, or there are individual market options that are available to pre-65 retirees through the individual market. So again, as part of the kind of analysis that Willis Towers Watson would do for you, they'll be able to look at your pre-65 retirees as well.
Great, and sticking with this theme, will Willis Towers Watson provide an analysis of possible monthly premiums that will be available for retirees on the open market?
Yeah, I mean, effectively that's what they're doing. They are looking at the most, the plans that are closest to the plans that the retirees are currently in, and then looking at those plans on the individual market and then determining, I've seen the analysis. It's usually done on an aggregate basis for the year, but obviously you can put it into a monthly analysis as well. So yes, it drills down to what the likely cost of various different options are for retirees. And again, the city would be looking at how much am I going to subsidize of that, and then therefore what are the net savings to the retirees in the city. So yes, is the answer.
Great, thank you. So the next question, so assuming Aetna provides quotes based on a blind pool, are these the prices for the first year, and is the second year based on actual experience going forward?
Yes, that's true. It would be based on the experience going forward.
Okay, and the next question is, so based on this understanding that some providers are allowed to provide quotes prior to leaving CalPERS, I think there's just a need for more understanding on that. Can you elaborate?
Absolutely. So, CalPERS has, I don't know, there's 6 or 7 insurance companies that work with CalPERS to provide networks and HMOs for CalPERS active employees and retirees. If you are a city that is part of the CalPERS system and you are interested in leaving, CalPERS will not allow you to get a quote, and it's not so much not allow you, it will not allow the insurance company that will work with CalPERS to provide a quote to your city until you have provided CalPERS with irrevocable notice that you are going to be leaving CalPERS. So you don't get to see the rate from the carrier that works with CalPERS currently until you tell CalPERS that you're definitely leaving, and then you can't come back in for 5 years. So again, it's a little bit of a catch-22, which is why we need to work with insurance companies that are outside of CalPERS to give you rates that you can compare to the CalPERS published rates, because I mean, it's unlikely that you would feel comfortable leaving CalPERS without knowing some rates to compare, that you had a guarantee of what your rates were going to be. So, so that's the situation. I don't know, does that think that's clear enough, Amanda?
Yeah, I think that gives us some more information. So this question is really similar. So CalPERS, they do not provide claims information to the cities to provide to the carriers for a quote. So would the cities only send the carriers their demographics? How would that work?
Yeah, so what we would be needing is the census information, but we need to make sure that it's really very well scrubbed with all the dependent information. So yes, we need to have census information, and then effectively what based on where your population is, the carriers know what their network arrangements are in that particular area, so they have an actuarial model that, again, they prefer to have the claims data as well, but they will look at your census, they look at the age of the people, the age of the dependents, and then they go through and they look at the discounts that they have with the particular hospitals and physician networks in your area, so they can, and they know about, consumption patterns of health care. All this goes into their analysis, and they are comfortable with making a quote based on that, which I refer to as blind pool pricing. That's the kind of the process that they go through in order to be able to provide a quote, even though they don't have the claims data.
Well, great. Thank you, Barry. I don't see any additional questions that are coming in. Did you have any final comments before moving on?
No, just say thank you very much for joining the webinar. Again, feel free to reach out to me directly. You can request more information about any of the services on the health benefits marketplace. And again, this is a process, which I would encourage you to start talking to us about it as soon as possible, because we can help you figure out this information to see whether or not this is a viable option, and we're ready to do that. So thank you very much, Amanda, for hosting this. I appreciate the opportunity to speak to everybody.
Great, thank you, Barry. And I think on the next slide we have some contact information. So if anyone has any additional questions, please reach out to us. As you heard from Barry Eyre, our lead consultant, we have his information. And for the retiree and active solutions on the health benefits marketplace, we have their contact information on the slide as well. And we really appreciate everyone joining us today. We hope you have a nice day.